It hasn't gone unnoticed that even as the US salutes frontline workers, in this case with military flyovers at a conservatively estimated $60,000 an hour over at least 22 cities, healthcare workers are being fired at alarming rates due to a lack of funds. And that's despite $100 billion in funding passed by Congress specifically to help medical providers. Preliminary estimates for April show a loss of 1.4 million healthcare jobs, with 135,000 hospital staff sacked, as revenue-rich elective surgeries and routine visits were cancelled.
These data report on the situation as of the 12th of the month. So what we're seeing today is what was going on in and around the middle of April. So I certainly think I would not be surprised to see more losses when we see next month's data.
317 staff were fired at this hospital in San Diego. Those who remain say some of those were frontline COVID staff. As with millions of others in the US, they're now without their employer-based health insurance when they may need it most.
Everybody was stunned, right? We're still devastated. We're reeling from that decision. Everybody's demoralized on the floors right now. And of course our work is being affected because a lot of the people that were laid off were nurses. And now they're worried that, okay, so after the 14-day, between 2 to 14-day incubation period, what if we get infected and now we don't have insurance? So it's easy for a lot of hospital executives to say, oh, you know, these healthcare workers and nurses are heroes. And then they can easily just drop us off like nothing.
But Palomar Health, which runs the hospital, said it had no choice. Not only is revenue down in areas not connected to the pandemic, it isn't treating high numbers of COVID patients either. Meanwhile, healthcare workers who remain are seeing their hours and wages cut while fearing job loss. And that's particularly so in what has been a little noticed but a growing sector in US medicine. Hospitals and medical staffing controlled by private equity firms. Wall Street spent $100 billion on healthcare assets in 2018 alone. Private equity's financial model is based on profits for investors that beat the rest of the market, and that's made these assets particularly vulnerable now.
Those emergency rooms are the ones that have been at the forefront of cutting salaries, of cutting doctor salaries. It's the extreme form of a for-profit system. They are reacting quickly in order to get their money out to repay their investors before the organizations collapse.
Private equity blames medical insurance companies for forcing them to make cuts. And it's true, insurance companies are already seeing and projecting healthy profits as a result of the pandemic. But as the emergency continues, while many flaws within the US's healthcare system have been revealed, increasingly there's debate as to whether it's the system itself that is broken. Shihab Rattansi, Al Jazeera.